Good morning, all. I'm Dr. Walter from SNS College of Physiotherapy. So, today we are going to see a new video regarding the pyogenic meningitis and the implications for the physiotherapy. So, all these contents have been taken from the Lindsay Book of Neurology. So, today we are going to see what is pyogenic meningitis and what are the treatments, the causes, diagnosis, and the physiotherapy management. Going for the introduction, it is a severe bacterial infection which causes the inflammation of the meninges. So the meninges, which is working as a protective covering in the brain and the spinal cord. So the early diagnosis and the rapid treatment are crucial to prevent devastating the neurological damage. So what type of bacteria it is affecting here? The Streptococcus pneumonia, Neisseria meningitis, Haemophilus influenza, all these things are taking place here to produce the pyogenic meningitis, which can lead to the morbidity and also the mortality. So we need to understand what type of pathophysiology and what type of common long-term things which are happening here. Now entering the pathophysiology, so first one is cerebral edema, which is usually called as the swelling of the brain tissue, which leads to the increased ICP, that is called intracranial pressure. And next stage it is going for the increased ICP. What will happen if the ICP has been increased? So it will compress the brain structures and the cerebral blood flow, it will go for impairment. Next, what will happen to the next stage? There is neuronal loss, direct damage, and the death of the brain cells due to the inflammation and the ischemia. So first the edema has been started with inflammation, next it has been going for the increased ICP, next it is transferred for the neuronal loss, and the last stage will be going for the vascular compromise, the reduced blood supply to the brain. So what will happen if the brain tissues will be going for low amount of blood supply? It will go for the deaths. Okay, now what will happen for the next stage? Common long-term sequel. So this slide, which implicates based on the 2010 meta-analysis report, what will happen if a patient is going for pyogenic meningitis? A hearing loss, a cognitive difficulty, motor deficit, seizure, behavioral issues, and the visual impairment. So if this pyogenic meningitis has been carried out for a longer period of time, that means chronic, so all these things will be happening. So what is happening in the acute versus chronic? So before the last slide we have seen based on 2010 meta-analysis for the chronic patient. So what is happening for the acute versus chronic? Subdural effusion, seizures, hydrocephalus, subdural emphysema, spinal abscess, quadriparesis. Paresis, which will be, we all know, like it is a muscle weakness, not a plegia, not a paralysis. It will be going for the muscle weakness. Chronic persistent neurological deficit, epilepsy, cognitive impairments, behavioral and learning difficulties, hydrocephalus, communicating and non-communicating, hearing and visual impairments. So these are the verses of the acute versus chronic. Now entering into the most important thing, that is the role of physiotherapy in management. So role of physiotherapy, which plays a vital role in this pyogenic meningitis, and it promotes the functional recovery. So what is the key goals? Cerebral perfusion enhancement, minimize secondary brain injury. Most important thing, the secondary brain injury, which will lead to death, and improve the mobility and prevent the contractures, reduce spasticity and abnormal muscle tone, which promotes the functional independence in daily activities. The interventions. So before we saw the key goals, now we are entering into the interventions. Therapeutic positioning to manage ICP and prevent pressure sores. So ICP, the increased cranial pressure should be prevented. Passive and active range of motions, increasing the ROM exercises. Sensory modulation techniques to manage the hypersensitivity. spasticity management strategies, including stretching and the splinting. All these things can be carried out in the intervention sector. Going for the protocol, and protocol which defines the initial neurological status, which will be going for the GCS Glasgow Coma scale, and motor function evaluation based on evaluating the spasticity and the rigidity. Sensory assessment, evaluate the light, pain, temperature, senses, proprioception. All these things will be happening here. The functional mobility will be going for the bed mobility, transfers from sitting to standing, standing to wheelchair, or standing to walking, and all these things will be going out along with the base, balance, and gait. ICP monitoring and the contraindications have been followed here. So next we're going for the evidence-based interventions. We'll be going for the NDT therapy and constant constraint-induced movement therapy, the balance training, and the gait training. All these things have been working as an evidence-based interventions. But what are the challenges we are going in the rehabilitation? Sensory hypersensitivity, behavioral outbursts, variable recovery rates, and the multidiscipline collaboration. All these things are the challenges which we are facing day-to-day life in the rehabilitative sector. Going for the prognosis, most important thing for a condition that the prognosis will be if, while a pyogenic meningitis can lead to severe sequelae, long-term outcomes vary based on several critical factors are evidenced by the clinical data. So age, severity of infection, and the time to treatment, all these three categories measures the outcome measure. So today we have learned about the pyogenic meningitis. Hope this will be useful for you. We'll meet in next class with a new video. Thank you.